Hi, this is Dr. Vivek Joshi and welcome to my YouTube channel. One of the subscribers has asked me about the treatment of uterine fibroid. So, if you are having fibroids, you have been diagnosed from uterine fibroids and your doctor has said you the only treatment is operation, so this video is for you. First of all, we have to understand what are fibroids. Fibroids are benign tumors that are formed inside our body. They are like a lump of flesh having the blood also in it. They are 3 to 4 in numbers, formed inside the uterus, near to the uterus. They are not life-threatening, but their complications can be life-threatening, so better to treat them. Now let's understand what are the symptoms, what are the problems that are caused due to the fibroids. The first problem will be their menses will be long. It may be of 7 days, 10 days, 15 days, even 20 days. Even I know some of the patients who said that they have whole month menstrual cycle going on. The blood is flowing on. Why? Because it's of the uterine fibroids. Second is lots of loss of the blood, which will cause decrease in the hemoglobin, and this is life-threatening. So there will be a lots of blood flow, even you can see the clots going in the menstrual blood. Third is the pain in the uterus, near to the uterus. Even the pain goes towards the legs also. Why? Because these are tumors, kinds of nodes, and these nodes, if they are big in size, they can press the nerves going near to the uterus, and these nerves, if pressed and they are the nerves passing to the legs, then you will feel the pain in the legs. The fourth symptom is constipation. Why? Because these nodes, these fibroids will press the organ nearby, and the nearby organ is intestine. It will press, and this can cause the constipation. The fifth symptom is frequent urination. Means a female will have urge to urinate frequently. Why this is happening? The reason is same. The fibroids are pressing the organ nearby, that's urinary bladder, and this causes the urge to urinate again and again. So now, as we have understand the symptoms, now we have to understand the causes. The causes are two. These are, if you have the history, it's the hereditary of fibroids in the family, the female has higher chances of having the fibroids again. And it can be because of the hormonal disbalance. See, actually these two are the not 100% causes of uterine fibroids. It is said that they can be the cause of uterine fibroids. What Ayurveda says? Ayurveda says yes, it can be because of the hormonal disbalance. It can be because of the hereditary, but it's not 100%. And what is sure according to the Ayurveda, it is that a female gives these problems to herself. Why I'm saying so? Let me explain you. Hormonal disbalance. Why a female have hormonal disbalance? It is not that you are having any hormonal disbalance, you went to a doctor and just start taking that particular hormone and it will be a treatment. No, it will not be a treatment. You have to understand why there is a hormonal disbalance inside your body. And Ayurveda says these are the problems given by a female. Why? Because which gland controls all the female hormones? This is thyroid gland. Now, thyroid is controlled by which gland? It's actually works by the stimulation of an hormone that is called TSH. That's thyroid stimulating hormone. And this hormone is secreted from pituitary. Pituitary, it's here. So what happens is, if any of the hormone is needed or there is need of functioning of thyroid gland, then the brain secretes, the pituitary gland secretes an hormone, thyroid stimulating hormone TSH, and it gives the trigger to the thyroid gland, and thyroid gland works. So if, imagine, a female is having lots of tension, pressure, lots of depression, anxiety in her life, what will happen? She is always not calm in the brain, and what will happen is this will hinder the work of pituitary gland, and the quality and the quantity of the TSH that is required will not be sufficient or good, and this will cause the hormonal disbalance. So the first treatment is to understand the cause. If it is one of the reasons that has given you these problems, so you have to understand that these things you don't need more. You have to come out of this stress, depression, anxiety, any kind of pressure. You have to come out because they have started giving you the problems, and this we all don't want. So this will be the first treatment. If you just go to the doctor and you will just do the operation of your these organs, or you will start taking the hormonal pills, it will not cure you for a long time, because the cause is inside and it will cause again the disbalance in another form. So the best treatment is to start working on yourself. This will help you on treating the myomas also, or fibroids also. Now the second line of treatment is diet. Ayurveda says the myomas or the fibroids are caused because of the lots of kapha in the body. Kapha means the mucus, or you can say it's like the fat, the extra fat in our body. This causes fibroids. If I say about the modern technology or modern medical science, the allopathy, they say that the high insulin is also one of the cause. Why? Because insulin is also an anabolic hormone which can cause the growth. Any kinds of extra growth in our body is cause of insulin. See, it's a similarity. Ayurveda has said that it's a kapha, means the fat. And what products increase fat? Those are sweet, those have lots of carbohydrates, that have lots of fat. Insulin, what increases insulin in our body? Same, carbohydrates, fat and sweets. So it's the same, both have said the same. What we have to do, we have to check our diet and we have to decrease the kapha products in our body. What is a kapha diet? Just type on internet, just Google it, you will find a whole list of products that you should eat, that you should avoid. Stick to it, start doing exercises, start burning your kapha, and it will also help you in decreasing the size of the uterine fibroids. I have seen in my practice, it really works, it really helps. So now moving towards the medicines. What medicines are best to be used? The Ayurvedic. The first is use of a powder called haridrakhand. This powder you have to eat 1 teaspoon 2 times in a day, 30 minutes after food with warm water. From 1 teaspoon I mean 3 to 5 grams. Second medicine is Kanchnar guggulu. This medicine is in the tablet form. You have to eat it 2 tablets 3 times in a day, 30 minutes after food with warm water. The third medicine is Shigru guggulu. Shigru guggulu. This is also in the tablet form. This also you have to eat 2 tablets 3 times in a day, 30 minutes after food with warm water. You have to continue this whole course up to 3 to 9 months. Do an ultrasound after 3 months or 4 months and see what are the improvements. But plus you have to follow strict to the diet and try to not to be in the stress or any kinds of mental like discomfort. You don't have to be in all this period. You have to come out of this. I don't say that never like always be happy. We can't do it. Just the thing is you have to come out of this problem fast. This is the only thing. Plus these 3 medicines you have to take regularly. And this will have effect. How these medicines work? If you will just search on internet about like Kanchanar guggulu, it is one of the best Ayurvedic medicine to decrease any kinds of extra growth in the body. Plus, if you will take haridrakhand and Shigru guggulu, these 2 things will also purify your blood, your liver, and will improve the quality of the lymph. The lymph circulation will be also better. So it will be like a complex treatment. It will improve the digestion, it will improve your metabolism, and plus it will decrease the size of this fibroids. So these things you have to follow it strictly, and this will surely give results. So follow all these recommendations, be happy and stay healthy.